Good evening, and thank you for joining us for the COVID-19 Safety and Summer Planning Preparation and Prevention Forum. Now that the COVID-19 vaccines are more widely available, many of us are making plans for summer travel, family outings, reunions, basketball games, and summer camps. And although many have been vaccinated against COVID-19, African Americans fall significantly behind the rest of the population in getting vaccinated. With so much hesitancy against the vaccine in our community, it's important to know how we can get out there and enjoy these summer months while still protecting ourselves and our loved ones. I'm Kira West, and I'll be your moderator for today. I'm a passionate entrepreneur, marketer, athlete, and writer. I currently work full-time in the tech and travel industry in addition to running my own businesses. I want to take a moment to thank our sponsor, GlaxoSmithKline, and thank our community partner, 100 Black Men of DeKalb. Thank you again to you, our audience, for joining us today, and know that we will share links to the resources discussed, including the GSK COVID-19 prevention brochure and handbook at the end of discussion and also on our website. We have with us today Dr. Melissa Clark, Dr. Jacqueline Hurd, and Dr. Omar Danner. Dr. Melissa E. Clark, a seasoned emergency medicine physician, is a pioneering leader in population health and health equity, working for and consulting with Fortune 500 companies, academia, and hospitals across the country. Dr. Clark has also been a pioneer in developing a telehealthcare coordination model for medically underserved patients in the U.S. Dr. Clark's career started at Howard University, where she has served as a faculty member in emergency medicine and assistant dean for medical education. Dr. Clark authored the popular patient advocacy book, Excuse Me, Doctor, I've Got What?, during COVID-19 pandemic. She has worked to establish a community-based response to the pandemic with faith institutions through the Leadership Council of Health Communities, and is a co-founder of the Black Coalition Against COVID-19. In addition, Dr. Clark hosts a weekly streaming health show and is a medical contributor on both CNN and the nationally syndicated Russ Parr Morning Show on Radio 1. Welcome, Dr. Clark.
Thank you so much for having me.
Of course. We also have Dr. Hurd. Dr. Jacqueline Hurd is the Executive Vice President and Chief Nursing Officer at Grady Health System. A California native, she moved to Georgia in 2009 as the Chief Nursing Officer at Atlanta Medical Center, Tenet Healthcare. With over 20 years experience as a nurse executive, her passion is inspiring and empowering nurses to lead. Since moving to Georgia, she has served as a member at large, president-elect, president, and immediate past president of the Georgia Association of Nurse Leaders. She is also an active member of the American Organization of Nurse Leaders. Dr. Hurd is a strong advocate for the March of Dimes, served on the MOD Atlanta Planning Committee and the Nurse of the Year Nominating Committee. She is very engaged in the nursing community and currently serves on several boards, including the Georgia State University Lewis College Community Advisory Board and the Emory University Nell Hodgson Woodruff School of Nursing Community Advisory Board. Dr. Hurd is married with 3 children and 7 grandchildren. Good to have you with us.
Thank you, Kira.
Also joining our panel discussion, we have Dr. Danner. Dr. Omar Danner is a professor of surgery and surgical critical care in Atlanta, Georgia. He is the founder of the renowned Reach One, Each One youth mentoring and medical exposure program for high school students. He served as an attending trauma surgeon and surgical critical care specialist at Grady Memorial Hospital for over 11 years. Dr. Danner also serves as chair of Healthcare 2.0 and the COVID-19 Pandemic Action Group for the 100 Black Men of America and as a member of the board of directors for 100 Black Men of DeKalb. He is the former chief of surgery at Grady Medical Hospital, as well as the director of trauma at Morehouse School of Medicine, where he served on the faculty for 12 years. Dr. Danner is now the president and CEO of Danbar for Life, a bariatric surgery, healthy lifestyle change, and weight management support service. Dr. Danner is a native of Birmingham, Alabama, received his medical degree and completed his general surgery residency from the University of Alabama School of Medicine. In 2002, he completed advanced fellowship training in surgical critical care and trauma at the Johns Hopkins School of Medicine. Thank you so much for being here today.
Thank you, Kara.
Of course. If you all could tell us briefly a little bit more about your recent COVID-19 experience. We'll kick off with Dr. Clark.
Thanks, Kara. Well, I'm all about empowering individuals to make decisions about their health and their health care. And so when the COVID-19 pandemic came along, I felt that it was very important to get facts out to people around the pandemic about staying safe. So I started a streaming show called Excuse Me, Doctor, that airs on my platform, Dr. Melissa Clark, on Facebook and YouTube, as well as on Sirius XM radio, which it'll about to be doing that. And then I've also talked to over 75 community groups, everybody from Black Ski to women's shelters, about COVID and about the vaccine. And then, as you mentioned before, I'm co-founder of the Black Coalition Against COVID-19. I also serve as a medical advisor to a group, the Leadership Council for Healthy Communities, that's a consortium of 70 faith-based institutions who do outreach to their congregants around social and health challenges with the pandemic. And then they link them to social workers at the Howard University School of Social Worker to help get their needs met. And then finally, I'm a member of the Department of Health in Washington, D.C., their scientific advisory committee for the safe, equitable, and effective distribution of the COVID-19 vaccine. It's been a busy year, but I'm, again, here to continue those efforts by being a part of this broadcast and, again, making sure that everybody has the facts that they need to keep safe.
Thank you so much, Dr. Clark. Next, we'll hear from Dr. Jacqueline Hurd.
Thanks, Kira. So what can I say? 2020 was a year like no other, not only for healthcare workers, but for everyone. It was a scary time, but what I would say is probably the most amazing thing as being the chief nursing officer for Grady Health System was the amazing work that was done by everyone on the team, not just the physicians and the nurses, but those individuals that were also responsible for making sure we had supplies and PPE. And so early on, when this came about, March of 2020, having to stand up our command center to ensure we had protective equipment for our employees, ensuring we had adequate hand sanitizers. A lot of things went into place to ensure that we were taking care of our patients safely. I would say, as I've said to others, in terms of just the amazing work, I would say in terms of communication, that was the most important thing, to walk around and to talk to our nurses and physicians. And everyone was afraid because there was so much that was unknown. So my role, I think the key experience that we had was just to reassure individuals that were coming in, that were on the front lines, that were leaving their families to come in and to make sure that we were taking care of our patients. And I think we go from 2020 to 2021, and now it's all about vaccination. So that's been our experience, and it's something that will stay with me forever in terms of our role that we played in that.
Thank you so much for sharing, Dr. Hurd. And next we have Dr. Danner.
Yes, Kara, thank you. And, during this pandemic, I've had the opportunity to work with the 100 Black Men of America on an initiative that we call Healthcare 2.0. And our aim is to hit the reset button on the health and the delivery of healthcare, because during the pandemic, what we've seen is there's an obvious discrepancy between the outcomes of people of minority descent, Black, Hispanic, Native Americans. And what we want to do is look at this from an educational opportunity standpoint. So we've conducted a series of town hall discussions talking about COVID-19 and these common chronic diseases, hypertension, diabetes, obesity, and heart disease, with the focus on educating people on what they can do to mitigate the effects of COVID, as well as these chronic diseases, which are going to be here after the pandemic. We work with the National COVID Resiliency Network to help educate and also provide resources to the community by banding to get together with similar and like-minded organizations and individuals and disseminated information throughout. And so, again, I want to thank Black Health Matters for the work that they've done. I want to thank Grady. I want to thank Dr. Clark for the work, the incredible work she's been doing and continues to do. And I look forward to a very exciting session and panel discussion this evening.
Thank you again to our panelists for being here with us today. We asked you to come together with us to shed some light on how we can all safely return to some sense of normalcy this summer, now that a good amount of U.S. people have been vaccinated. Let's kick off with you, Dr. Danner.
Thank you, Carol. Can I have first slide, please? I really do appreciate the opportunity to speak this evening. There's, again, I know a lot of still angst. We're still in the midst of the pandemic. And so I want to thank everybody who's really worked very hard throughout this to try to turn the tide. In December of 2010, the Advisory Committee on the Immunization Practices for the Center for Disease Control and Prevention met with the FDA, the Food and Drug Administration, and they approved the first set of vaccines, which actually now today is 6 months in the making. Since this rollout of vaccines, the following week, the second mRNA vaccine was approved. And since then, there have been another vaccine approved by Johnson & Johnson. And since these vaccines have been approved, the recommendations have actually been moved now from adults to even children as young as 12 years old. Next slide. What I want to discuss this evening and educate you on is there are not one vaccine. So when people say, did you get the vaccine? We want to expand your understanding to understand there are different options, different platforms for vaccines. The two first vaccines to roll out were mRNA vaccines by Pfizer and Moderna, but there's also other formulations or platforms such as the adenoviral vector, the recombinant viral vector vaccines by Johnson & Johnson and AstraZeneca. And then there are also protein subunit vaccines, and these are antigens, which we hear about the spike protein, which is a antigen that similar to the angiotensin 2 receptor. So there's a receptor that's found in the lungs and the kidney that helps regulate blood pressure and other things that this virus mimics. And so the strategy is to create a transcript, an mRNA transcript that will help the body to produce this antigen so that we have earlier recognition. Next slide. About 2.5 weeks ago, there was 163,000 plus, almost 164,000 people, or 49% of the population, which had received one of these vaccines. Overall, 39% of 130.6 million people had been vaccinated in the United States. In the U.S., there were 357 million doses that had been distributed, with over 286 million doses used. Next slide. These numbers have continued to rise over the last few weeks, and now we've administered over 303 million doses of this vaccine. The number of people who have been infected with this virus in the United States, which is the number one country in the world as it relates to infections, is actually over 33 million. And there have been over 598,000 deaths, now approaching 600,000. These deaths are starting to slow down a little bit, but we are nowhere out of the woods. But we're getting better than we were when we first started. By some accounts, by other accounts, we still have a little bit of a challenge that we'll discuss in a little while. Next slide. Worldwide, there have been over 2.2, if you count today's numbers, vaccines administered. And now we've crossed over 173 million people have been infected, with over 3,700,000 people who have died. When we look at the numbers from when the pandemic first began and compare it to the first 6 months of this year, there's another startling number that there have been 1.8 million deaths over the last 6 months, compared to 1.8 million deaths this previous year. So the numbers for this year running has actually surpassed all of 2020. Next slide. So when we look at this map, this is a map of people who have been fully vaccinated in the United States. We see a lot of heterogeneity, a lot of differences. The darker colors represent areas where people have been fully vaccinated at the lowest level. So if this is 0 to 1%, and then the yellow areas represent where there are people who have been fully vaccinated at 80 to 90%. There are very few areas of yellow throughout the country, and mostly dark blue or light blue, meaning we still have a lot of work to go. Next slide. There's another concept, and this is called vaccine hesitancy. There's resistance to people getting vaccinated for COVID-19. On this chart, it shows in the dark blue areas, this is where there's estimated hesitancy at a lower rate, and these are these darker areas. And then the lighter areas, again, represent where there's a higher rate of resistance. These are areas like in Montana and the Dakotas. This is Alabama. This goes up through Kentucky and Ohio. So just understand that there is still some resistance. It occurs in patterns. There are other some states where the resistance is lower than there are others, but it suggests that there's still a lot of work to be done. We'll talk a little bit later about why there is this resistance. Next slide. If you look at now COVID vaccine data based on race and ethnicity, we see that for people who have received at least one dose of the vaccine, 62% of them are Caucasian, 9% in the African American community, 13% in the Hispanic community. When you look at people who initiated vaccines in the last 2 weeks, you see that the numbers are starting to pick up in the Hispanic community, but there's no significant change in the African American community, with a slight drop off in the Caucasian community. And then when you look at the total population, these numbers stay pretty consistent. So throughout the pandemic, throughout the rollout of Operation Warp Speed, there's still been a low rate of acceptance and adoptance in the African American community compared to other nationalities. Next slide. And so when we look at this trend over time, what we see is these numbers are rising in Asian Americans and Caucasian Americans, but in Hispanic Americans and Black Americans, these numbers are staying relatively flat. And so we have still a lot of work to do, because in the Black population, Native Americans, and Hispanic populations, there's been a decided differences in mortality and morbidity related to this COVID-19 pandemic. Next slide. So what can we do? As we're now approaching summer, and now we have vaccines, we have the tools and things that we need to really address the pandemic. What we have to do is get educated on what our options are as it relates to vaccination. So what I encourage everybody to do is to go to a reputable source, the CDC's website and other sources, and read up on each of the vaccine. Know what your options are. Discuss this with your doctor. As far as it relates to prevention, understand that we still have to practice good, level-headed, common sense and preventive strategies. So wearing masks if you're in high-risk situation, washing your hands, and then in situations where it's appropriate, practicing social distancing is still a reasonable recommendation. But the second thing is just optimizing your overall health by getting regular exercise, 90 to 150 minutes of vigorous or moderate exercise each week, trying to eat a healthy, balanced diet, and where you can't eat perfectly on a regular basis, consider supplementation, vitamins, vitamin D, whatever you may want to take, vitamin C. There are a lot of different things out there, but just trying to be healthy overall. And this gives you a better chance to fight any kind of infection in general. But in the end, getting vaccinated is important because people who are vaccinated tend to have a 10 times less chance of having a bad outcome from the coronavirus. As the slides show, people are still dying from the actual viral disease. So we're not out of the pandemic. This is not the time to do the wave or throw up the victory sign and run a victory lap. Next slide. We have to continue to practice safety first. So in order to halt this COVID-19 pandemic, everyone is going to have to participate and be a part of the process. The risk of COVID-19 and premature death are much higher and likely due to this novel coronavirus contagion than from the risk of receiving the vaccine. However, again, anything medication-wise can be associated with some risk. So, you have to read up, study, know what your side effects are, know the risk and benefits of these things. But just remember, African American and Hispanic Americans and Native Americans continue to be at higher risk of COVID-19 related disability and death, but they still lag in getting the vaccine. So this is the time to get involved. If you want more information, next slide, you can go to the National COVID-19 Resiliency Network website and pull up your state by clicking on resources. The web address is https://ncrn.msm.edu. I want to thank the panel for being here. Thank Black Health Matters, and I want to thank the listening audience for the opportunity to speak to you this evening. Thank you, Kara.
Thank you so much, Dr. Tanner, for sharing such valuable information. Dr. Clark, are there any concerns regarding new COVID-19 variants and the effectiveness of current vaccines against those variants?
Great question, Kira. Could you please cue the next slide? And yes is the answer to the question. There are some concerns that we need to know about. Next slide. But first, we have to understand what are variants and why are they important. So you have to know that viruses need a host to survive. They can only survive for a minimum of a few days, a maximum of a few days outside of the body. Next. And then once they get into the body, their whole goal is to reproduce, make more little viruses that you will then cough or sneeze out to that may infect other people. And once they get into your cells, they turn your cells into a virus making factory. So in the case of the coronavirus, a coronavirus making factory. The way they do that is they give the blueprint, the instructions to the cell. And you may have heard these words like messenger RNA or DNA. Those are the genetic instructions as to how to make more virus. And so the cell does that. It makes more viruses. Next. And in the process of making those viruses, there's a chance that a mistake might be made, basically a change in some aspect of the virus's appearance. And that's what leads to change, a variation, which leads to the word variant, right? Now, we know about the famous variants, the UK variant, the South African variant, the Brazilian variant. Next. But the thing is that anytime in your body a variant can pop up, it doesn't necessarily, though, give it an advantage to be more infectious or more deadly. The UK variant, the Indian variant, the South African variant that we hear about, the Brazilian variant, are all more infectious. They are making younger people sick in the case of the Brazilian variant for sure. And they can potentially reinfect people who've had COVID-19 already with the original strain of COVID-19. So next slide. So then everyone's concerned about, well, will the vaccines work against the variants? So the variants that we know of, as I mentioned, that are all more infectious, they're up to spread up to 50% more easily. We do know that the vaccines do provide some level of protection. The Johnson & Johnson vaccine was actually tested in South Africa and in Brazil at the height of the pandemic, when these strains, the Brazilian strain and South African strain, were the dominant strain in the population. And so we know for a fact that it works because it was tested in a real life setting. And we have heard that it's at least 85% effective in keeping you out of the hospital and 100% in preventing death after 28 days after vaccination. The Pfizer and Moderna vaccine also provide level of protections against the variants as well. Next slide. And so the other thing that's really important to understand, other than whether the vaccines provide protection, is the reason why it's important that people get vaccinated as soon as possible is because a variant can pop up in you if you are not vaccinated. If you get full-blown COVID or a coronavirus infection, whether it's no symptoms or whether you end up being very sick and in the hospital, either way, as the virus reproduces in your body, there's a chance that a variant might pop up. And we don't know if that next variant will be the one that can evade the vaccine. And so that's why it's important to put that firewall of vaccination up. The more people that get vaccinated, the stronger the firewall will be in terms of preventing the spread of coronavirus in the population and preventing the emergence of a potential variant that might evade the existing vaccines that are out there. So thanks a lot for giving me opportunity to explain that, and I'll look forward to sticking around to get some of the questions from the audience later.
Yes, thank you so much for more information on the variants and effectiveness, Dr. Clark. That was really impactful. Dr. Hurd, in your experience working in one of the country's largest healthcare centers, especially one serving a predominantly Black population, what are you seeing and hearing regarding vaccine hesitancy? What are some of the reasons people are still hesitant about the vaccine?
So, hey, Kara, if you don't mind, if I can give a couple stats for my Georgians that may be out there listening to this panel interview. While Dr. Danner gave an overview, gave some pretty big numbers as he talked about what's happening within the U.S., I'm just going to kind of narrow it down to talk about Georgia. Next slide, please. Next slide. So when we talk about in terms of Georgians, when we look at Georgia, and this data is as recent as June 8th, a total of 41% of the population in Georgia have received their first dose of a vaccine, and 35% are fully vaccinated. When we look at gender of those same numbers, 43.8% female and 37.3% are male. Georgia is one of the first states to deliver the Pfizer vaccine that was approved for ages 12 to 17 years. Next. When we look at it by race, and again, this is for the state of Georgia, and at least have received one vaccine. And Dr. Danner talked about in terms of within the African American community, 31.3% African Americans have received at least one dose of the vaccine, 37.7% of white, 70.7% Asian, and 38.1% American Indian or Alaskan Native, and the other others were 75.7%. So when we talk about age, and again, for the state of Georgia, probably at least 40, when we look at the age range from about 45 and above, starting at 45 to 55, 50% have received the vaccine. We've seen our highest number of patients are Georgians who have received the vaccines, 75 to 84 years of age, 100%. And that's due to the work that was done in the nursing homes. Next slide. So when we talk about hesitancy, and again, obviously there's a lot of either hesitancy or people choosing not to get the vaccines based on the numbers that I shared with Georgia and as well as what Dr. Danner showed. What we see in Georgia is the highest number in terms of that are hesitant to get the vaccine is that we're seeing that in the rural areas. And the questions are why. A lot of people don't trust the science. It was too fast, or it's just too much that's unknown. When we look at African Americans, we talk about the history. And again, not trusting the science, wanting to see more data, concerns about rumors of people getting sick, the infamous Tuskegee Institute study, and it was developed too fast, and they want to wait and see, or wait until mandatory for healthcare workers. And so when we look at not only for our African Americans, but also when we're talking about healthcare workers, because our numbers are low for healthcare workers as well. And some of those same concerns are being addressed as to why healthcare workers don't want to get the vaccine, hesitancy, unknown, and just kind of waiting it out to see. Some of the things that I know that we are working on is really trying to get to the people, get to the rural areas, get into the community, work with the churches, and just really continue to educate our community partners in terms of the options. And as Dr. Danner said, it's so important to be informed and to know what your options are and why it's important. I know earlier on when I was asked in terms of why are you getting the vaccine? I, like everyone else, there was concern, but the one thing that I knew for sure was that COVID kills. And so I and my family decided to take our chance with getting the vaccine. That's why we were vaccinated. So thank you for the question, Akira, and thank you for the opportunity to be able to speak. And I'm looking forward to staying around and answering any other questions with the other panelists as well.
Thank you so much, Dr. Hurd, for telling us more about the statistics in Georgia and where the hesitancy is really coming from. I want to kick off our panel. So to kick off, are there any thoughts from you all on new innovative ways to overcome the hesitancy in the Black community and get more people vaccinated so that we can all get back to normal?
So as part of the Black Coalition Against COVID, one of the initiatives that we're working on with the University of Maryland is working with beauty salons, stylists, and barbers to educate them to become sort of certified health workers to discuss the COVID vaccine, and also down the line, other issues that lead to health disparities in the Black community. And so that's kicking off this week. Stylists and barbers can go sit through a 4-hour educational process. They get reimbursed for their time. And then also too, if they're willing and it's feasible, their salons can also be used as vaccination locations in the Black community. The same has been true for clergy and churches. We've been doing that actually for quite some time in the DC area. And I know around the country, clergy and churches have really stepped up to the plate to make sure that that message gets out about vaccination, and also volunteer their churches to be sites, or their faith institutions actually to be sites for vaccination.
I agree. And I think piggybacking off of what Dr. Hurd said and then adding to what Dr. Clark said, it's important that we as a medical community engage the leaders in the community and the people. I think that it's very important that we address the concerns of the members, the citizens of this great country as real, and then try to educate and inform, because as Dr. Hurd said, Dr. Clark is saying, the deaths, the toll, is real. This is not a quote like some people still think it's a hoax. People are inside the hospital. There's still people who are dying, and worldwide in other countries, the numbers are starting to increase. Brazil and countries like Argentina, India is really having a bad outbreak, and it can happen here. In fact, over the last several days, the last week or so, there's been a slight uptick. It's gone from about 14,000 to on Wednesday to as many as 20,000 new cases. So we're not out of the woods, and we're not out of the woods until we're out of the woods. So we have to work together to shut this pandemic down. As I said earlier, everybody's going to have to participate. So this is a rallying cry to do your part, educate yourself, understand the risk and benefits, and then again, if you feel comfortable, I don't want to, advocate one way or the other, get vaccinated. If you don't feel comfortable, stay away from people, eat right, exercise, take your nutritional supplements, but don't infect somebody else. We have a responsibility to our brothers, our sisters, and our neighbors. And we have to think, I call it being other people minded, to give the nation and the world the best chance. So that's what my initial advice would be. Dr. Hurt?
And Kira, I would just add one other thing. And so it was interesting because we thought in the hospitals, we saw so many patients that were dying that when the vaccine came about, that healthcare workers, physicians, nurses, they would be standing, knocking people down in order to get the vaccine. And that's not what we saw. And it's interesting what we started doing here at Grady, which has been just phenomenal. We basically took the vaccine to the people. So we basically put a vaccine on wheels, as we call it, a vaccine on wheels, and we went into the nursing stations. We were hanging out at the time clocks. And we were just making it really, really easy for people to get the vaccine, because when it's right there, you don't have to go stand in line. We just come in this room, we're going to cheer you on. And we really saw that we increased the number of those people that were hesitant to get the vaccine by just making it easier and going around to the nurse's station, going around to the time clocks, being in the cafeteria, because it's right there. It's like, okay, can't be any easier than that. So what are you going to say? No, yeah, we did have to do some tugging and encouraging for people to get that. But, you can usually look at the ones that are saying no, and it's like, you're not going to talk me into it. But yes, that's what we saw in terms of really being able to increase for healthcare workers.
And if I could just add, I think that's an excellent point that Dr. Hurd made. We're doing that in communities too. That's the whole idea behind the barbershops and the churches, but also just taking mobile vans and doing pop-ups in different locations in the communities, especially because we know where I'm in the DC area, which specific communities within DC, their low vaccination rate. So making it as easy as possible, because for some people, it's not necessarily a matter of I'm not going to take the vaccine. It's not convenient because they might work 2 jobs or they have childcare issues. So it's also making it easy, making the times ones that they can use to access the vaccine.
Thank you so much for sharing your perspectives. That was such great insight into innovative ways to overcome the hesitancy and for us to continue to stay safe. So speaking of back to normal, shifting gears a little bit, we mentioned earlier, many people are already getting back out there now that it's the summer, the weather is warmer, and several cities and states have lifted their restrictions. Ballparks are open, restaurants are near capacity, people are visiting amusement parks, traveling to visit family and friends, and really getting back out there. So what are some recommendations that you all have for staying safe this summer, especially with 4th of July holiday coming up next month? How should we move forward with planning, preparation, and prevention this summer in light of the pandemic and the COVID-19 virus still being with us, even if a large number of the population is already vaccinated?
I think that's a great question. I was just looking at some statistics, and we actually have made a lot more progress than we realized. Currently, I think it's about 50% of the U.S. population, they've been vaccinated. Of the 100 million doses that President Biden promised and wanted to get rolled out, we almost 85 million of those doses administered. And so we have about 15 million more to meet his goal in the next 23 days. So what we have to do is, in addition to thinking in terms of like vaccines in general, we have to think in terms of just staying safe. So I think at the end of the day, we have to maintain those preliminary recommendations, having sanitation with you, where so sanitize, alcohol-based sanitizer, wearing mask if you're in a congested area, if you're out in the park and you're out in the air. I think it's reasonable to not wear it if you're around people that you're comfortable with, that you've been around. And thirdly, I think that at the end of the day, if we take this seriously and practice and follow the guidelines that we've learned over the course of the pandemic, what we've seen is even our kids, they went back to school, there was no cases of outbreaks because they followed these rules and guidelines. They do work. I think the wrong thing to do right now is to discard the guidelines and the safe practices. We need to maintain them until we're safely out of the pandemic and there's agreement that we've actually achieved what we're all aiming to do, and that's break a pandemic. And that would be my recommendation.
I'd love to add to that excellent explanation that Dr. Danner just gave by saying I think we have to think about, am I vaccinated and am I not vaccinated? We know that people who are vaccinated, when they travel on airplanes or in crowded places, still need to wear a mask and do all the other behaviors to prevent COVID as before. People who are unvaccinated in every situation, not just crowded situations, need to continue to mask and distance. And so what are we talking about for the family reunion? Do we know who's vaccinated and who's unvaccinated? No. So we're pretty much, if you're going to get together with family, take inventory, understand who's vaccinated, who's not vaccinated, wear your mask, protect the most vulnerable of your family members, those who are obese, those who have chronic underlying health conditions, those who are older than 65. Those are still the risk groups, and we need to continue to protect them. We know in some pockets of the African American community, the vaccination rate is less than 20%. And so even as we are have the wonderful goals of 70% of the country being vaccinated by July 4th, we know that there are going to be pockets, especially in our community, that aren't. And so those individuals are going to be at higher risk. I would encourage you to get vaccinated as soon as possible. And then the last group of people are those who are 11 and under. When they go to summer camp, they're going to be unvaccinated. But we have been able to show, as Dr. Danner mentioned, that if you wear your mask and practice social distancing, that you can prevent outbreaks of COVID-19. So if you're evaluating a summer camp for your children, you need to make sure that they have all the safety protocols in place. If they're going to be indoors, have proper ventilation, make sure that most of the activities are outdoors, ideally, and make sure that they have the children's safety in mind.
And Dr. Danner and Dr. Clark covered everything. The only thing that I could add is that, when it's a family reunion, make it fun. Have a mask contest. Make sure you have adequate masks. And there is no shortage of hand sanitizers anymore. So have plenty of hand sanitizer and give everybody a hand sanitizer. Have hand sanitizer stations. So those are the things, again, I think that Dr. Danner and Dr. Clark spoke to, that, we still need to do those things, and don't count on people to have their masks on or bring it. Make sure you have extra masks there for everybody.
I love that. Did you have more to add, Dr. Danner?
Yeah, well, I did, and I was only kind of doing this from the standpoint of just other things that kind of common questions that, kind of seeing people ask. It, as Dr. Clark was saying, these variants are starting to enter the country. And so that what that says is this virus is changing, it's mutating, and that means we can't drop our guards. The things that Dr. Hurd are saying about sanitation, wearing your mask and protecting yourself, even if you've been vaccinated, there's a dark side to this, that there's a breakthrough. Some people can still carry it. They may not be as sick. They can still infect you with one of these things that their body may be able to fight off, but you can't. So you have to really think in those terms, vaccinated, unvaccinated, and understand that a person who is vaccinated can transmit one of these mutant strains and you can get very sick. So that may be the impetus for you considering taking this the vaccine, whichever one you choose. The other thing that I'd like to say is, some people wonder, well, what's in the vaccine? The primary thing that's in the different vaccines is an mRNA transcript, whether it's on a viral vector or not. That means there's a piece of the virus that they've copied and it's used to make a protein off of that virus. The reagents that it's mixed with, you could probably go online and Google it and look those kind of things up and, look at the reagents. Not basically probably the best forum for this. But the last thing that I'd like to say is that with these different vaccines, there are other vaccines that will be coming down the pipe. And this was the first group that made it through the FDA, and others are still coming. I think that since we're now addressing the kids, 12 to 18-year-olds, we have to really look at this as a long-term logistics issue. And as somebody else was saying, having multiple vaccinations of older people and people in mobile communities is difficult. Vaccinating kids 4 times, 3 times in a year is going to be logistically challenging. And so we're going to have to look at what is the best approach to basically administer vaccines in that population over the long haul. And so that's something that's going to be another subject of discussion and debate. But we need to be thinking about logistically, is it going to be possible in a year cycle to vaccinate 75 million kids 4 times? And so, those are just things that I want to throw out to Dr. Clark, because I think it's an important discussion for our listening audience, and Dr. Hurd.
The only thing that I would add, Dr. Danner, in terms of just like when this first started, it's like, do you wear a mask? No, you don't wear a mask. We know in terms of the vaccinations, in terms of now it's going to be for the kids, or is it going to be mandatory when they go back to school? Some schools will, some schools won't. What is the booster going to be? Are we going to have to get a booster? Is it going to be with the flu vaccine? So I think that we're going to continue to learn. There's going to be more and more information that we're going to continue to learn and how to best to handle that.
Thank you so much for the information on how we can stay safe this summer, and then how we can keep our loved ones safe too, and for adding more clarity around the vaccine and what the ingredients are, as well as maybe what's to come. I know we want to have some time for Q&A, so I really quickly just wanted to get your thoughts around knowing that we're going to come in contact with different people through work. What would you say are some of the concerns and precautions that we should take for businesses as they're looking to bring their workers back in the safest way possible?
So I think for businesses, there are going to be a couple questions. Number one is, if people are working in an office situation and the office has been shut down for a while, there also needs to be mold remediation, changing the filters, making sure that the building is sound and that the ventilation systems are effective. And then there need to be protocols in place. Perhaps you don't bring everybody in on the same day. Some people continue to telework so that you don't have crowding in your office space. And then the next thing is, do you need to, will there be a mandatory vaccine? The EEOC just ruled that employers do have a right to make the vaccine mandatory if they feel that it is right. I know, especially in healthcare businesses, that's going to be a big issue. It doesn't supersede state law. So states, I believe Alabama is one of the states that have said that employers cannot mandate vaccines. So your state law is going to be supersede all that. But employers will probably be paying attention to all these things to understand how to make sure that their workforce stays safe and how their workforce can keep their customers safe as well.
Thank you so much. Did anyone have anything to add on that really quickly before we move on to a couple questions?
I think, one other thing is that employers need to have clear policies in place. There are, like Dr. Clark is saying, state laws, but also at the CDC and other, places, there are actually copies of protocols that can be used to guide how you're going to bring people back to work safely. I think the biggest thing is to think about the whole strategy, the overall plan, and not basically make the vaccine the plan. It has to be more comprehensive and well thought out, and it has to be iterative over time. We're going to learn new things. And someone's asking about the different strains of the new strains, like the Delta strain or the UK strain or the Paris virus. There are going to be new variants, and as the virus changes, some of the variants may be more aggressive, more infective than others. So doing all these things to mitigate against whatever variant and shutting down this pandemic as quickly as possible is going to be paramount to the success of us as a country, as a human race.
And the new strain, the Delta strain, is more infectious, as we mentioned before, but the three vaccines appear to be effective against this new strain.
Thank you so much. I know that we wanted to transition, but we've already started answering some of our audience's questions. So does anyone have anything else that they can share about the new vaccine that's entered the US and what the effectiveness looks like, or just any other thoughts there?
The new vaccine or the new variant?
My
Yeah,
apologies.
that's the one I just spoke to regarding, it's called the Delta, or other people might know it as being from India. And it is more infectious, but there is coverage from the vaccines against that particular variant.
Amazing. Thank you so much.
Yeah, I think that the important thing to realize that, as the pandemic has progressed, the age in the population who actually are carrying the vaccine, carrying the virus at least, has actually shifted to younger populations. So now individuals 18 to 29 are actually the biggest carriers, and they're the ones that are actually more likely, or maybe even Dr. Hurt can speak to this, most likely to be admitted to the hospital for COVID-19. In addition, in some areas where it's really indigenous, in some counties, the number of people who are infected, or the percentage of people who are infected, are now in some areas, predominantly African American descent or African descent. And so there's now some ethnic and racial shifts as people are getting vaccinated, and then other groups are unvaccinated. So the interesting thing is, and the important thing is not to ignore that. And so follow the trends. And so stay informed. This is about informed consent. And what we're trying to do is just give you the information so you have full disclosure. And so that's why I want to turn it over to Dr. Hurd, because, she's inside of the environment and she gets to see this up close and personal.
So our numbers, speaking from Grady, our numbers are down. So, we're definitely in the teens. And it's just still right now, it's kind of a mix. So we have not seen as many of the younger people. We're seeing people that are coming in that are not as sick. I think, as you spoke to earlier, Dr. Danner, what we're seeing now that's really inundating the hospitals are those chronic diseases that people weren't coming in to get treated. And so now they're much sicker.
Okay.
And what's happening, I think, nationwide is 75% of people over 65 have been vaccinated. So they're out living their best lives. But unfortunately, what that means is the proportion of younger people who have not gotten vaccinated, either because they haven't gotten around to it or they don't want to, that's where we're seeing the virus show up more. And so we are seeing sort of nationwide proportionally more younger people getting sick, as Dr. Danner mentioned. And here in DC, 8 out of 10 new infections are among African Americans. And that is a direct correlate to African Americans being the least likely in this area to get vaccinated. And so it's a real decision that we're making. When we make these decisions, it's for our own individual health, but it all is also for the health of our community, the people that we are around the most, our church family, our blood relation family, our coworkers. We're making a decision that affects not just us, but also the people that we're around and the people we love.
That's such a great point. I think, it's not just about ourselves, but it's about our loved ones as well. And so I appreciate that you brought that up. I know that there was just one last question, really, but it's about the ingredients. And I know that this was answered a little bit before, but if there is any more information on what those are, or any final thoughts that you have as panelists before we wrap up for the evening.
So the blueprint for how to make the spike protein of the virus, which is that genetic material, either the DNA for the Johnson & Johnson vaccine or the messenger RNA for the Pfizer and Moderna vaccine, that's the key ingredient. It's surrounded, in the Pfizer and Moderna example, by a fat droplet. And in that fat droplet, to stabilize it, is a sugar and a salt. The exact chemical names, you can find it on the FDA website, but that's essentially it. For the Johnson & Johnson vaccine, it's, instead of being enclosed in a fat droplet, is enclosed in another virus, which has been killed or deactivated. And that virus, even if it were alive, it causes just the common cold. It's called an adenovirus. But basically, that's the sort of transport mechanism to get the instructions into the body, and that's essentially it. There's been a lot of social media and rumors about what's in the virus, in the vaccine, but it's pretty simple and pretty straightforward. And the only reason to not get vaccinated, if you're in the eligible groups, 12 and older, is if you've had an allergic reaction or are allergic to one of the ingredients in the vaccine. All the other concerns, talk with your doctor, go to the website that Dr. Danner mentioned. Also, the Black Coalition Against COVID has a website as well that you can go to also find more information about the vaccine.
I agree. I agree with Dr. Clark wholeheartedly. And what I'd like to say, particularly there's somebody they were asking about diabetes, and where there's diabetes, where there's heart disease, where there's any chronic disease, this has been a wake-up call, and this is the time to really start taking this from the standpoint of personal responsibility, optimize your health, understand and know your numbers. We've been doing a program with Healthcare 2.0, which involves persistent electronic physiologic self-monitoring, because during the pandemic, people were separated from their healthcare providers. They're staying home and basically not managing their chronic diseases appropriately, and then they're getting worse, and now they're presenting. And as Dr. Hurd is saying, that's who's really presenting back to the healthcare system. And so as people get sicker, if we have another wave, there's something called capacity. That capacity has been taken up, and this recreates the problem. So hopefully we learn through this that when we can and we have to understand our numbers. We have to be involved in our care process, working with our doctor by becoming informed, understanding nutrition, understanding exercise, understanding what your numbers are, what's your blood pressure target, what's your blood sugar target. Keeping within those parameters keeps you safe in the face of a COVID-19 or a Staphylococcus aureus or a Streptococcus pneumonia infection. It does not matter. All infections are bad if your numbers are out of whack or out of sync. So optimize yourself, optimize your health.
Thank you so much, Dr. Danner, for tackling that very important question from our audience. Again, just in closing, Black Health Matters wants to thank you, our panelists, Dr. Melissa Clark, Dr. Jacqueline Hurd, and Dr. Omar Danner, for being here with us today. We know how busy your schedules are, especially right now. We also want to thank our audience for joining us this evening. A very special thank you to GSK, GlaxoSmithKline for supporting this really important Black Health Matters COVID-19 Community Outreach Initiative, and our community partner, the 100 Black Men of DCAB, for their support. I also want to direct audience to blackhealthmatters.com, where you can find additional information and resources, along with the other items that we shared throughout the presentation, and also to the COVID-19 brochure and handbook that is provided by GSK. And we look forward to seeing you soon. Have a safe and healthy evening.
Thank you for having us.
Thank you for having us and enjoyed it. Thank you guys.
Thank you.